It's a pleasure to be with you. The title of this talk is Cultural Distance, Societal Factors. There are no disclosures for this presentation. Objectives include review the cross-cultural communications model, discuss approaches to decrease cultural distance, discuss the link between socialization and enculturation, review the definition and associated attributes of community, review the 5 major functions of a community, review the link between the social determinants of health and community functions, discuss the attributes of dysfunctional communities, discuss the important role of the built environment on community socialization, review the concepts of class, status, and roles, and vertical and horizontal communicators in community engagement, discuss the concepts of foreignness and marginalization in community engagement, and briefly review the role of coalitions in the community engagement process. Claude Shannon and Warren Weaver developed this cross-cultural communications model. This diagram lists 8 parts to consider when communicating from a source to the respondent, including encoding, message delivery, decoding, context, noise, and feedback. Communication is extremely important for productive interactions between individuals and groups. This diagram also lists the 7 dimensions of cultural distance when communicating or interacting with another culture, or even between subcultures within a community or society. The more culture or group X differs from culture or group Y in the 7 dimensions listed on this slide, the greater the cultural distance between those cultures or groups. Those 7 dimensions include worldview or deep beliefs, cognitive processes or ways of thinking, linguistic forms or ways of expression, behavioral patterns or ways of acting, social factors or ways of interacting, media influences or ways of channeling messages, and motivational resources or ways of deciding. There are 2 major strategies to decrease the cultural distance: enhancing the effective transfer of messages and meanings to reduce risky behaviors in the respondent culture. Cultural immersion or enculturation of the message source in the respondent culture is possible, but generally takes time, months to years if ever, to accomplish. This obviously doesn't fit well with most grant or program schedules. A more efficient route is to use message sources or individuals from the target culture who are already enculturated, since they live in that culture. They understand and practice within the 7 dimensions that impact cultural distance, including the socialization behaviors and norms that we will briefly discuss in this talk. Utilizing message sources from a target culture is a major concept of community engagement. This talk will focus on societal factors, or ways of interacting, also described as socialization. Individuals are raised in societies that hold certain behavioral expectations for members. Societal members undergo enculturation and socialization that informs and reinforces those expectations. This enculturation socialization process has great influence on the development of an individual's personality. Enculturation is essentially assimilating the deep beliefs, values, institutions, accepted behaviors, and norms of a culture. Socialization is how individuals interact with others, expressing their cultures, beliefs, values, institutions, behaviors, and norms assimilated through the process of enculturation. From the application or practicing those expected behaviors and norms, individuals learn who they are, where they fit, and how their behaviors, thinking, words, and actions impact the social status they have been assigned by their community. A major point is that societal interactions and behaviors are based on cultural beliefs and values as diagrammed. So enculturation influences the way a culture or society socializes by teaching and instilling in members the culture's beliefs, values, institutions, behaviors, and norms. This interaction between enculturation and socialization isn't unidirectional, but cyclical or bidirectional. Effective enculturation requires a mechanism to transfer cultural information. Socialization, or the interaction of societal members, is a major tool societies use to enculturate members. Let's illustrate some links between socialization and cultural beliefs. A common American cultural belief is that every individual is seen as being of infinite worth and having rights that supersede the claims of society. President John Adams underlined this thought by saying our government doesn't exist to protect the rights of society, but to protect the rights of the individual. For 2 centuries, American cultural beliefs and values regarding individual rights are reflected in not only the behaviors or socialization of Americans, but also in many federal, state, and local policies. Other cultures have different socialization beliefs regarding individual rights. In traditional Japanese culture, it's the responsibility of the individual to promote the ends of society, since they view the individual as impermanent while society is constant. Therefore, it's important to invest in and emphasize Japanese society more than the individual. In traditional Japanese culture, there is no one symbol that relates to I as an American would understand it. These different socialization beliefs also manifest themselves in many societal behaviors, including the way various societies and cultures introduce themselves. For example, an American often introduces himself or herself by the first and then the family name. In many instances, the first name is often the only one used. This emphasizes the cultural belief of the importance of the individual. In the traditional Swedish culture, individuals often introduce themselves by first stating their occupation and then the family name. For example, I'm truck driver Peterson, emphasizing the societal importance of the work a person does. A traditional Japanese individual will often introduce themselves by first mentioning the larger social group or community to which they belong, then their family name, and finally their given or first name, emphasizing their belief in the importance of society over the individual as previously discussed. So if a person's name is Hiroshi Motoyama and he works for the Takashimaya department store, he often introduces himself as Takashimaya's Motoyama Hiroshi. The way cultures and societies introduce themselves, along with many other socialization behaviors, provide valuable insights into their beliefs and values that inform those socialization behaviors. There are several ways individuals make socialization connections or interact with each other. A majority of those connections occur within the context of a community. For this session, we will discuss some general community concepts and their relationships to socialization, and then consider a few additional thoughts regarding class, status, and roles, the concept of community foreignness, and coalitions. Let's now briefly consider the concept of community. So what is a community? Community engagement specialists often define community differently versus other organizations. Many organizations define community by geopolitical boundaries, living in a certain area of a large city, living in a certain township of a rural area, etc. Key attributes of a community to a community engagement specialist would include 1. People in a community know each other by first name, which usually limits a community size to about 1,000 to 1,500 people. And 2. True community members have a sense of shared responsibility, fellowship, belonging, and obligation to other members of that group. The following situation illustrates a difference between a geopolitical and common community engagement definition of community. People may live in the same apartment building and know each other by first name, but not feel an obligation to help other individuals in that building when they experience a personal disaster like death, loss of their job, severe illness, etc. Using the geopolitical definition, individuals in that apartment building would be considered members of a community. To a community engagement specialist, they would not be a community if they failed to meet the 2 key attributes listed on this slide. Using these attributes versus just a geopolitical definition, communities may then include prostitutes working in a region of a state, street children living in a sewer system of a large city, ethnic groups scattered across a country, a small rural town, schools, businesses, faith-based groups, and various organizations like Kiwanis, Optimists, Knights of Columbus, sororities, fraternities, etc. Beyond the 2 key community attributes of knowing each other by first name and having a sense of shared responsibility for each other, true communities may also, but not always, live in the same geographic area, as mentioned above, have common norms, laws, rules, and statutes, use the same language, and hold similar cultural beliefs, values, institutions, and behaviors. True communities that meet the key attributes on this slide provide incredible socialization opportunities for their members. True communities perform 5 functions listed on this slide. 1. True communities provide members with reasonable opportunities and support to meet community members' needs. This translates into the community helping its members meet their social determinants of health. The social determinants of health can be considered in several different ways, as illustrated on this slide. Healthy People 2020 defines them as economic stability, neighborhood and the built environment, social and community context, health and healthcare, and education. Other terms used to describe the social determinants of health include those listed on the left side of this slide: economic, spiritual, emotional health, physical health and wellness, which includes environmental health and education. No matter the terms used to describe the social determinants, the main point is that there are multiple factors or determinants that influence the health and wellness of people, and all determinants of health must be considered and addressed by communities to improve the wellness and health of their members. 2. True communities provide members with socialization avenues or opportunities. The community utilizes these socialization avenues to instill within members the community's and culture's beliefs, values, institutions, behaviors, and norms, as diagrammed and previously discussed. This process of instilling beliefs, values, institutions, behaviors, and norms would also be considered the process of enculturation, learning the various layers of the cultural egg diagrammed on this slide. The deepest layer relates to a culture's worldview or beliefs about human beings, nature, the supernatural, and time, past, present, and future. It's upon these deep beliefs or worldview that a culture builds its values, or things that a culture feels are important. It's upon these deep beliefs and values that a culture designs how things are done, translating into cultural norms that then inform their institutions, like the way they govern themselves, educate their children, marry, run their businesses, etc., and also the way they behave in their society, culture, and community. Methods of socialization and enculturation may be steeped in a community or cultural tradition impacted by modeling of respected formal and informal leaders and reinforced through more formal teaching methods. 3. Communities provide social controls. Communities develop ways to enforce adherence or conformance to community values and norms. This may take several forms, from informal community pressure to more formal laws, rules, and statutes. 4. True communities provide members with social participation opportunities. The community fulfills member needs for companionship and sense of belonging. This may occur through many venues, including faith-based programs, business activities, educational groups and opportunities, book clubs, bingo parties, music concerts, recreation activities, health and wellness programs, internet connectivity, various disability and special population programs, etc. 5. True communities provide members with a sense of shared responsibility and concern for community members and the community at large. This function enables members to cooperate to accomplish tasks too large or too urgent to be handled by a single person, like raising funds to support a community hospital or clinic, building a playground for children, organizing a community response to drug addiction, etc. It also provides a network of support for individual members and families who have suffered a significant loss, tragedy, or illness, etc. These 5 community functions are essential for adequate and healthy socialization of community members. Unfortunately, not all communities or societies are healthy. This slide lists some common attributes that dysfunctional communities lack, including clearly defined roles and goals, shared beliefs, values, institutions, and behaviors, clearly defined boundaries, community member ownership, provide valued roles for members, communicate effectively with members, adequate skills and resources, meet needs of members, and share and draw on skills and resources where needed. Most of these community dysfunctions are associated with poorly engaged communities. It may indicate a group that fails to meet the definition of community, or indicate poor leadership, etc. Poorly engaged communities often result in community deficiencies, gaps or unmet needs related to the social determinants of health, the economic, spiritual, emotional, or physical health and wellness, which includes environmental health and education, which can in turn result in further deterioration of community socialization and engagement. Sick communities, like sick people, often need help to recover. Public health is well positioned to facilitate a community engagement process to help break this destructive cycle and encourage communities to appropriately engage to address the social determinant needs of their members that can in turn result in enhanced engagement and socialization. For a few minutes, let's consider some common social determinant physical environmental factors that can impact community socialization, including population size and concentration, noise, community design, also called the built environment, including many aspects like housing quality, play settings for children and whether those places are safe, and transportation resources available to community members, including access to a subway, buses, personal automobiles, walking and bike paths, etc. This CDC statement summarizes the importance of encouraging a healthy community-built environment. By working with communities where people live, work, and play, we can increase opportunities for physical activity, reduce the risk for road traffic injuries, asthma, and heart disease. Safety and infrastructure improvements to transportation systems can also improve access to everyday needs like healthy foods, health services, recreational and socialization opportunities, helping people live healthier lives. This slide lists some roles public health can play in encouraging a healthy community-built environment, including influence policies at the national, state, and local levels through wise advocacy, provide technical assistance, including education on best practices, facilitate community engagement as previously mentioned, encouraging communities to own their problems and solutions, including strategies to improve the health and wellness of their members, which is influenced by things like a healthy built environment. Facilitate coalitions. Strategizing and building a healthy community infrastructure often requires diverse expertise and the coordination of resources of many stakeholders. For example, several community coalitions include local, state, and national park administrators in an area to develop and promote healthy hard exercise programs, including walking and hiking trails, etc. Public health is often in an excellent position to facilitate coalitions around a healthy built environment. Health outcomes associated with the built environment is a fertile area for public health research. Communities provide powerful venues to improve the health and well-being of their members. Community activities to improve health benefit through socialization opportunities and can be significantly enhanced through effective community engagement. Community engagement is a relatively new tool in the population-based toolkit to change risky behaviors. Public health is well positioned to facilitate community engagement. Some basic community engagement concepts are essential for the training of community engagement facilitators, including the 27 topics listed on this slide. These topics provide the basis for a community engagement curricula. Let's consider societal connection concepts associated with class, status, and roles as they relate to community engagement. All societies have elements of class status and roles. Class is defined as a continuum between open and closed. Open societies allow relative ease of communicating and moving between classes versus closed societies. The United States and England would be considered open societies where India and Spain are more closed. Generally, there are 3 social classes in each community: upper, middle, and lower. Class is associated with certain behavioral expectations and is fairly well defined. For example, a person living in a certain part of town may be associated with a certain social class. Certain jobs may be associated with class. A physician or lawyer may be considered upper class in some communities where other jobs may be associated with the middle or lower social classes. Superimposed on the class system is a status system and roles. Status is the social position assigned or achieved by an individual. A role is the acting out of one's status. Every member of a society or community has his or her statuses and roles. A man may have the status of son to his mother, physician to his patients, and elder in the church. In each of these statuses, a person is expected to fulfill certain roles or behaviors. Generally, people want to interact with people of equal or higher status and seek to move up in status with every opportunity. With that last statement in mind, a person can generally only significantly impact those of equal or lower status. Influential individuals are located at the upper end of each class in a community. These influential individuals are the go-to people of the community who have exceptional skills to influence community members. These individuals are commonly informal leaders, also known in the literature as horizontal communicators, peer communicators, opinion leaders, influential individuals in class, and champions. These individuals have exceptional ability to influence the beliefs, values, and resultant behaviors of those in their class but equal to or below them in status. A horizontal communicator may be recognized as the go-to person for a certain topic area, like health, yet may not be a recognized influencer in other topics like spiritual issues, economics, or politics, etc. A horizontal communicator for health issues may be a health professional, like a nurse, physician, nurse practitioner, chiropractor, etc. For spiritual issues, it may be a tribal medicine man or woman, or elder in a church. For political issues, it may be a community activist. A major strategy of community engagement is to identify and adequately engage the horizontal communication systems of each class in a target community. These last three slides point out the complexity of comprehensively engaging a community, which requires not only appropriately engaging horizontal communicators in each class, but also those who are identified as community and class opinion leaders in specific topics like politics, health issues, spiritual matters, etc. Failure to appropriately engage the right influential individuals in their appropriate topic areas of influence may result in failure. This is an important slide demonstrating horizontal and vertical communication between classes, which also relates to all social interactions between and within classes. Both horizontal and vertical communication is important for successful community engagement in changing risky behaviors. Communication from a higher class to lower class, vertical communication, generally results in high prestige, medium message volume or capacity, and low to medium persuasion potential. This would be like utilizing a movie or music celebrity or professional athlete as a messenger. Public information officers often seek out these types of individuals since they have broad name recognition. Yet realize that these celebrities will only have marginal persuasion potential. They often suffer from silver spoon syndrome. Comments often heard include, "They don't understand the reality of life in my situation. It's nice that they care, and I respect them for that, but they don't really identify with my needs." Low to higher class communication, we'll call reverse vertical communication, is generally poor, associated with low prestige, message volume, and persuasion. Horizontal communication is generally associated with moderate prestige, but high message volume and persuasion. Horizontal communicators, representing the upper status of their class, live in their community and class, enhancing message volume and persuasion. The utilization of horizontal communicators is a major tenet of true community engagement, finding well-respected individuals of high status within their class who can effectively communicate horizontally within their class. Horizontal communicators are commonly informal, not formal leaders, and therefore often not effectively engaged and used in community engagement programs. These horizontal communicators have incredible potential to influence community and individual behaviors, and if not appropriately engaged, can undermine community engagement in a target area. Having said that, prestige support, formal leadership support, higher class to lower class communication or vertical communication is also important for successful engagement. An essential first step in community engagement is to obtain formal leadership support for the program or message. Their support will lend authority, respect, and prestige, though that support may not have great impact on message volume and dissemination or persuasion to all classes in the community. Lack of support from community leaders is devastating to a community engagement process. A main point is that horizontal communicator engagement within each class of a target community is generally the most effective social communication method to change behaviors. Personal advancement through success in education, business, politics, etc., may result in a situation called class transition. For example, as an individual increases their education, obtaining certificates and degrees, they commonly improve their job marketability and move up the job position ladder. At some point, that change will influence their status and even class. In these circumstances, particularly as they move from one class to another class, they can lose contact with and even the ability to effectively communicate with members of the class they left behind. So individuals who are successful may sacrifice horizontal communication advantages of their previous position and subsequently move into a vertical communication position associated with high prestige but relatively low message volume transfer and persuasion potential. A community engagement specialist and program leadership need to consider this phenomena of class transition when choosing horizontal communicators. Status and class movement can change an individual's ability to be an effective horizontal communicator. For a few minutes, let's consider a few concepts of foreignness in socialization and community impact. Foreignness to a culture can be an asset or liability. As an asset, foreignness can provide an opportunity to present radical ideas. A foreigner to a community is obviously not a community member and is expected to act differently and have different ideas. For example, when working in Nyankundi, Zaire, now the Democratic Republic of the Congo, community members thought we were strange. We exhibited behaviors foreign to their culture. We used handkerchiefs to blow our noses in. One Zairean laughed when asking why we wanted to keep that stuff rather than blow it out on the ground. They also thought it strange that I would use a portable exercycle, a white man pedaling as fast as he could, sweating profusely and going nowhere. We were strange. We looked different. We exhibited unusual but interesting behaviors. They expected strangeness from us foreigners. They may not have been as understanding with those from their own culture if they exhibited those same behaviors, since they would be expected to behave within the community's and culture's norms. So foreignness to a community or culture can sometimes be an asset an opportunity to demonstrate and even introduce new, strange, and even radical ideas. Foreignness can also be a liability associated with skepticism. A foreigner with their strange practices, behaviors, and ideas may not have had time to develop appropriate relationship strength and trust for credibility within a community. They may also not have had time to demonstrate it in a convincing way the benefit of their strange ideas to the community, leaving those ideas on trial. Due to their obvious differences, communities are generally skeptical of outsiders and their ideas and often resist them. This underlines the importance of that basic community engagement concept of finding and engaging horizontal communicators in the community engagement process. These important individuals are already enculturated. They understand and behave within the communities and culture's norms. They are respected due to their status in their community and class, and therefore considered a credible message source. Message source credibility is particularly important for messages and discussions around significant community change. During the community engagement process, it's important to consider the following questions. How do the community members who are associated with the community engagement process relate to other members of their community or society? Are they located on the margins, or are they within the community mainstream? Marginalized individuals are those who, for one reason or another, are located on the fringe of their community and are therefore often deprived of the privileges or acceptance as full and respected community members. In my experience, because of their fringe position, they are often more accepting of external community engagement facilitators and ideas and seem at first to be community engagement champions or opinion leaders. For example, Gerald Swank worked with Nigerian leprosy patients, providing treatment and rehabilitation through their program. Many patients were cured of their leprosy through use of a standard multi-drug treatment regimen. Some of these leprosy patients attended school, completing degrees in various disciplines, and returned to their communities cured of their disease. Yet the stigma of leprosy marginalized them, preventing their acceptance back into the community mainstream, even though they were now highly educated individuals. As a result, their ability to influence was severely curtailed by their seemingly permanent status as a leper, a marginal community member. Unfortunately, if they were identified and engaged as a potential community champion, horizontal communicator, or opinion leader, they would likely not be very effective. Having said that, their status and influence as opinion leaders and champions in other communities, like the community of leprosy patients or others stigmatized by current cultural beliefs and values, would likely be significant. Marginal community sources will likely have marginal message influence, more limited transfer of meaning, and ultimately result in a marginal change of behaviors or impact on the community as a whole versus mainstream sources. Community status of potential community engagement champions or horizontal communicators must be carefully considered in the community engagement process. One can invest incredible resources for minimal change if the community engagement process misidentifies horizontal communicators. Ensuring community versus external facilitator ownership of the community engagement process will generally assure identifying appropriate horizontal communicators. Let's discuss societal connections through coalitions for a few minutes. This slide reviews what I call the community engagement continuum. Community coercion is located at the left of the slide. This is where things are done to and for people. Community engagement is on the right side of the slide. This is where things are done with people. In between, we find consultations and building of partnerships and coalitions. The closer a program gets to the right side of the chart, the more community ownership and true engagement. The Centers for Disease Control and Prevention, in their book titled Community Engagement, defined community engagement as the process of working collaboratively with and through groups of people affiliated by geographic proximity, special interest, or similar situations to address issues affecting the well-being of those people. It is a powerful vehicle for bringing about environmental and behavioral changes that will improve the health of the community and its members. It often involves partnerships and coalitions that help mobilize resources and influence systems, change relationships among partners, and serve as catalysts for changing policies, programs, and practices. Coalitions that heavily represent communities versus external partners encourage community ownership and true community engagement. Coalitions can be defined as a union of people and organizations working to influence outcomes on a specific problem. Coalitions accomplish more through collaborative efforts than individual organizations working separately. This union of people and organizations working together on problems is a powerful avenue of community socialization. It's important to note that coalition building is not the same as community engagement, but can be a part of community engagement. The term community engagement is often misused. Much work in the name of community engagement is actually community coercion, where external experts gather and analyze community data, design a response, apply for a grant, and if funded, attempt to sell the project to the community. This is not community engagement, but community coercion. Webster defines coercion as the use of physical or moral force to compel to act or assent. Community coercion rarely, if ever, results in community ownership. True community engagement is the facilitation of communities to own their problems and solutions. Good coalition building uses many concepts of true community engagement. The CDC states that engaging a community is ultimately about facilitating community-driven action. That community action includes effective coalition building. Public health activities are often defined as promoting, protecting, improving, and when necessary, restoring the health of individuals, groups, or the total population. This slide lists the 10 essential public health services or domains that were described in 1994 by the Public Health Functions Steering Committee. 1. Monitor health status to identify community health problems. 2. Diagnose and investigate health problems and health hazards in the community. 3. Inform, educate, and empower people about health issues. 4. Mobilize community partnerships to identify and solve health problems. 5. Develop policies and plans that support individual and community health efforts. 6. Enforce laws and regulations that protect health and ensure safety. 7. Link people to needed personal health services and assure the provision of health care when otherwise unavailable. 8. Assure a competent public health and personal health care workforce. 9. Evaluate effectiveness, accessibility, and quality of personal and population-based health services. 10. Research for new insights and innovative solutions to health problems. The essential service of mobilizing community partnerships is all about community engagement and effective coalition building at the community level. Both community engagement and coalition building tap into and influence the powerful dimension of socialization and must be appropriately addressed in cross-cultural communications. In summary, utilize horizontal communicators for efficient and effective community engagement. Enhanced socialization is a result of an engaged community. Socialization is a major tool used by communities to enculturate members. Use the 2 key attributes to identify communities. Public health is well positioned to facilitate community engagement. Coalition activities are often a part of an effective community engagement process.